during the rainy season, there is a problem of shortage of food in the house. So things used to be hard. You have to go and labor in somebody's farm, and the person will pay you before you get what you'll buy as your daily need.
I now live like everybody. I could remember when I first knew it, I struggled to start the drugs, but my health kept suffering me.
The Integrated Child Health and Social Services Award (ICHSSA) is a 5-year project funded by the United States Agency for International Development (USAID). The ICHSSA project started in 2019 and is implemented by Pro Health International as the lead organization, with Catholic Relief Services serving as a technical partner. The project seeks to mitigate the impact of HIV and other drivers of vulnerability in Adamawa, Taraba, Bauchi, Sokoto, Zamfara, and Kebbi states. The program is designed to uplift the lives of vulnerable children and their families by offering sustainable economic opportunities and a range of integrated health services.
The ICHSSA project is basically a response to the challenges that households on the program face.
An yi training na kwana uku yadda za mu shiga community mu enrolling mutanen da za su benefitin daga wannan project. Bayan kwana biyu aka kira mu aka ba mu selected house waɗanda suka zama cewa sun cancanci shiga wannan program.
Catholic Relief Services led 2 strategic components in the project: Household Economic Strengthening (HES) and Health System Strengthening (HSS). The ICHSSA Economic Strengthening adopted a family-centered approach. This approach seeks to achieve microeconomic stability in the short and medium term for vulnerable children and their caregivers. Some of the key interventions and impact achieved by the project include cash transfer.
When I collected that money, I went to the market immediately to buy food items. I bought male and a female chicken, and some of the money I used it for my family.
Mun samu tallafin kuɗi da kuma mun samu tallafin abinci. Ya mun abu da yawa. Wasu sun tafi ta hanyar makaranta, na yi amfani da shi, wani kuma ta hanyar abinci, kuma na sayi kaji.
This support improved child nutrition and food security, allowing households to provide, sell, and store food for lean seasons. Savings and Internal Lending Communities (SILC). 558 SILC groups were established across ICHSSA implementation communities. The SILC group comprised 14,739 members, including 7,042 direct program participants who have adopted and developed a savings culture.
Kuɗin da zan kashi ya zama na ajiya. Sai ga an samu ni cilom ni sai generator ina amfani da injini na har na koya ma kuma mata nika kuma an ka biya ni. Na rinka sana'ar takalmi da ƴan kunne da kunu da kosai da safe.
Sali abin da yasa na shiga wannan abu muna dan sa kai da kai anan ina zuwan dan karfafa shi mu yi bukatar mu da yara ko ba lafiya haka.
More than 60% of SILC participants have also received 2 or more additional interventions either prior to or as members.
An taimaka mini da oven, yanzu ina sana'a da shi yana nan gidana. Wani lokaci zan gasa kifi, wani lokaci kuma zan yi kayan snacks. An zo an fasa asusu bayan wata 8 an bani kuɗi. Na yi amfani da wannan kuɗin ma yarana da kuma business ɗin da na fara.
Sai ya samu saiti sai ka tayar da shi. Sai aka bani injimin da aka bani rana na yi kuka sosai. Na samu ina shiga cikin tsohuwar kasuwa wurin masu gwanjo. Iyata sun koya mata sana'ar ɗinki. Yanzu haka iyata tana ɗinki.
Technical vocational training and assets transfer. 4,762 OVC caregivers acquired business skills to establish or manage micro-businesses tailored to local market contexts.
Alhamdulillah, ina iya yin takalmi lahiya lau. Sana'ar takalmi kuma ba sana'a ce wadda zaka wahala ba. Ni ma kuma in Allah ya so ya yarda, idan na samu an sallame ni daga shago ni ma zan samu wasu ƙasa na in taimaka musu.
Sai ta zo wani rana suka zo nan ta kawo mana mai mana training. An koya mana inda da mu tarbiyar da inji da yadda da mu kiyaye kanmu. Injin ina markaɗe da shi.
Na zaɓi ɗinkin tela ne saboda shi ko da yaushe ana samun kwastoma na. Kuma in kana ɗinkin telan nan ba za ka rasa kwabon kashi ba.
Gaskiya mun samu taimako sosai dan an ba mu kuɗin transport, an ba mu kayan aiki.
Micro-enterprise development.
Wasu qualities ya kasance you are opportunity seeking.
Haka na sana'a dai tana ta taɓarɓarewa sai na yi kamar na ga riba sai in zauna. Haka na tahiyar ka ta tahiyar muna ko da wani lokaci. So sai da baya sai ya ce min in to a yi mana training. Akwai inda ake yadda aka koya mutum yadda zai sana'a.
An nuna mana shekara yalukan da take da shi. Ga kowane irin yanayi za ka nemi irin sana'ar da za ka yi saboda kasuwancinka ya ci gaba.
Da Allah ya sa na samu kaina cikin waɗanda za a ba tallafi na injimin gasa kifin kuma na yi farin ciki sosai. At least cikin wata ina iya gasa shi so 4 kowane sati so 1 kenan.
Aka ba da kuɗi aka koya min sana'a, aka koya min kayan snack da donuts da samosa da meat pie da kek. Ina kuma yi ma 'yan buki da na gida da kuma 'yan makaranta haka suna shi.
Already some of the members have already started taking the loan and doing the business. So when we bring this micro enterprise development training, that is when they become very curious, meaning that they begin to learn. Some of them begin to become curious about the way they were doing their business by then.
The ICHSSA Health System Strengthening HSS is both a major strategy and project principle. It recognizes capacity development as a key driving force to sustainable development. The System Strengthening Services approach, which serves as the backbone of this project service delivery to OVCs and caregivers, is a multi-level capacity strengthening initiative to improve Nigeria's social service system. The project strengthens the organizational systems and technical capacity of State Ministry of Women Affairs and Child Development and the social welfare departments of local government areas to coordinate response to vulnerable children effectively.
ICHSSA being a partner that is coming to sponsor more lives in the state, we make the commitment to integrate those that has been paid for by ICHSSA into our vulnerable program pool, such as the basic healthcare provision funds and the ICHSSA. We find this necessary because every member of the community, including those that cannot afford to pay for themselves, are being supported by partners.
The CRS collaborated with Basofka in terms of strengthening the system of OVC across the state by creating synergy between the CSOs and the local government officials also. The key structures are the institutionalization of the OVC technical committees.
One of the key and major things that was implemented, which was an innovation during the project, is the ensuring that OVC parents and their caregivers were enrolled in the state health insurance. It's a very good innovation that will ensure that we eliminate or achieve our goal of eliminating HIV by 2030.
Junior brother had been enrolled to this program, so I got to know about these free drugs through him, which I also came in here and then I started enjoying the same benefits with him, because I know without those drugs, I know possibly a lot of things would have happened.
DCW ne suka zo gidana, suka zo suka ɗauki yarana da ni suka sana in safo. An ɗauki hoton mu sannan aka da ya kwana biyu sai aka fito mana katin bashima yaro na a ciki an mishi aiki har ya sha jini, ni ma na kwanta an ƙara min jini duk da katin bashima.
We have a monitoring mechanism whereby on a quarterly basis our team will go to these facilities to ascertain the quality of services provided to these OVCs. And as I'm telling you now, based on the first phase of the OVCs that were enrolled, we have over 1,000 of them who have visited the facilities.
It also empowers local civil society organizations through a grant mechanism where 16 CSOs in 6 states receive sub-grants to improve their technical capacity.
So for the HSS, they have done quite a lot in terms of child protection, ensuring we partner with the National Population Commission to ensure that all these OVC under this project have gotten birth certificate.
Our participation in the collaboration was to train their volunteers, their staff, who goes out now to the field and do the birth registration. give our children an identity. They have helped us a lot to at least register the backlog of children that was missed out during our routine birth registration, particularly some of them that has been affected by the influence of insurgency.
We've also have advocacy and resource mobilization committee, which was inaugurated for the purpose of ensuring continuity and sustainability of their program.
They normally support the ministry when we are celebrating our special days like the Children's Day, the Day of the Gay Child, also our 16 days activism. They also sensitize the communities, young girls in schools, how they can speak up in case their right is being abused or infringed.
One good thing I like about ICHSSA is before beginning of any intervention or training, they usually come to the ministry. We have a discussion, we plan together with them.
Your project has seriously instituted the self-reliance and then self-dedication and then tolerance in searching of goods that will benefit the entire inhabitants of our own communities.
Wannan tallafi na cash transfer saboda har ga Allah ya taimake ni ba kaɗan ba. Ina samun biya kuɗin makarantar yara, ina kuma samu in ci abinci da shi.
This is a lot. Only for the tests that they run for us, the viral load test, the drugs, I know it costs a lot. So we are grateful to USAID, ICHSSA, and also Pro Health and CRS.
So these are all strategies that the ICHSSA project kind of tries to work with, just so that households that are not yet at the level where they are able to manage their consumption and also to be able to manage financial shocks, being able to develop seasonal financial calendar.
I feel actually elated for many reasons when you look at the actual story and see how this partnership is affecting the lives of vulnerables in the state. You feel proud to be part of this important program.